We're live now, Chair. I'll hand over to you.
Thank you. Good morning, colleagues. Welcome to our Public Integrated Care Place Board for Rotherham on this sunny Wednesday morning. I hope you're all well. So I'm aware that we've only got an hour and we've got quite a packed agenda this morning. So if we can move straight on. Any further apologies to be noted that on the agenda, Wendy?
Yes, we've received apologies from Catherine Singh at Rotherham, Doncaster and Southampton Healthcare Trust, Richard Jenkins at TRFT or the Rotherham Foundation Trust, Councillor Roach and Ben Anderson, both from the council.
Thank you, Wendy. And I'm aware we've got Helen standing in for Susie joining today. You're welcome, Helen. Thank you for that. I don't believe we've received any public or patient questions today. So if we move straight on to our first business item, which is the transformation group updates. Colleagues, could we take them slightly out of turn if that's okay? Can we move to the second item, which is improving access to psychological therapies that Ian and Matt are going to take us through this morning?
Yeah, thank you, Chair. Morning, colleagues. So I'm just going to try and share the slides. I'll ask Matt just to work through the slides if that's okay, Matt. But before we do that, just a huge thanks to colleagues working in IAPT, Chair, if we can. This is an area of high demand in terms of access to provision over the period of the pandemic. So we're really thankful for both services that are delivering IAPTs across Rotherham, both the RDASH provision and IESO provision, which is a digital service that support the delivery in our place. So hopefully, is that just shared for you, Chair? Can colleagues see that share? Yeah. Okay, Matt, do you want to come in terms of what's working well?
Yeah, absolutely. Thank you, Ian, and thank you, Chair and colleagues. In terms of the IAPT service, we've also had some significant developments during the pandemic, as people will have been aware from previous presentations. So digital offer, telephone offers have worked really well with the IAPT service. Productivity across the teams were improved as well, but we had a slight downturn. The top section around the reliable improvement rate shows that the improvement in the benefit that people receive from the intervention. It's slightly different to the recovery rates that are covered later on. We've got an increase in face-to-face and group offer. There is a bit of a challenge in terms of space, as people can imagine that prior to the pandemic, we were working in a large number of the GP surgeries, but space is still at a premium out in primary care, and we've got all the other pressures around maintaining safety. So that's still something we're juggling with, but increasing in terms of face-to-face contacts. Big pressure for us had been around, for the partnership, had been around our CBT waiting list. So that's the kind of second level of interventions that people receive, the formal CBT therapy. With around 460 people on the waiting list for CBT. Subcontract with IESO, there's actually it says 150, there's a larger number of people have been sent to IESO for that, and we've now got a reduction down to, I think we've got 260, or approximately 260 on the waiting list now, so significant decrease in that waiting list, and consequently in the waiting times for individuals as well. As a comment on there about the IESO stuff, obviously IESO far more have got the flexibility around off the offer, so a significant proportion of their work being done out of hours, which is a great offer for people in terms of accessing therapy. Positive patient feedback from IESO at the bottom of slide 1. Recovery rate, an important one at the bottom of slide 1 there, shows the recovery rate, previous rolling 12 months, 52.5%, national target's 50, so a positive for Rotherham as an overall rolling figure. I think that's okay on that one. The next one in terms of what we're worried about. Thank you. So in terms of staffing, we've got always got challenges with the IAPT service provision, and that's predominantly because recruiting qualified staff is difficult. I think certainly over the last 12 to 18 months, we've found that people don't want to make sideways steps. So if they're already qualified and working elsewhere, there's a reluctance to move, and I think we're experiencing that with other staff and that's part of the pandemic and the pressures that people are feeling around their lifestyles and the changes. The other challenge for IAPT is that any discussions around increases in funding that we have with the CCG and arranged jointly are about recruiting people. Funding now recruits people in September and February next year, and then consequently the full impact of them once they've done the training doesn't kick into the year after. So we're always kind of working up 2 years ahead. So there's a real need to do that kind of proactive planning ahead for what we're wanting. In terms of notes, obviously the long-term sickness management with staff we've got in place, we've certainly experienced and certainly over the last 3-4 months, the increases in short-term staffing, COVID related due to isolation that we've had with for some staff. They're an interesting group in that they are probably our youngest cohort of staff and predominantly female. So maternity leave is actually much higher proportionally than other areas of service provision that we've got. Which is kind of all has to be supported appropriately, but it's worth us kind of bearing in mind. And we started to do pieces of work around that staffing profile for future recruitment. CBT waiting list is still there for us, so we've still got that. Despite the positive ISO work, we still need to have foot on the gas on that one. Recovery rates. There's an error on that bottom bullet point just to highlight to people. Recovery rates, it talks about there being down at 41.7% January. That's actually a typo. It should be 47.1%. We've never been down as low as 41 to 42%. So that is corrected on the next slide. So just to highlight that one. I think the next one, Ian, if that's okay. So the what next, obviously, in terms of staffing profile and capacity and demand. The ISO stuff is helping us with the step 3, which is the formal CBT work, but we need to do better recruitment to shift the balance so that we've got more of those step 2 workers, the CBT therapists, and the national guidance is a 60-40 split. ISO's got plans to continue their social media campaign. RDash are doing their own campaign. We've done several campaigns that Gordon will be aware of. And particularly around recruiting people where they've got health inequalities or additional needs, and the leaflets are being updated. So we've got regular meetings between both providers, RDash and ISO, and the CCG in terms of that wider communication and wider advertising, and specific things around the Sign Health service at the bottom there. So for deaf adults accessing therapy, improving things there as well. I think that's a bit of a whistle stop that probably covers it, if that's okay.
Yeah. Thanks, Matt. If I could just conclude there, Sharon, I think I'm echoing from you. I think what we are kind of seeing within our right provision and many other areas of mental health is that continued demand, not just coming out of pandemic, but as we also go into different phases with kind of economic demands in the system and the impact of that on our place. So I think we will continue to review capacity in the system. We are, I think, in a fortunate position whereby we've got 2 really good services, one via RDash and one via ISO. So we have, I suppose, some of the decisions we made as a place board going back 2 years ago, Chair, now of trying to get in that additional capacity to support the RDash pathways and also introducing virtual IAPT into our place, which we're one of the first in the country to do that. I think has stood us well through the pandemic. I do think we just need to keep reflecting on what the right model for our Rotherham residents is going forward, because there's definitely something in that virtual as well as face-to-face and group work. So thank you for that, colleagues. I'll take any comments or questions. Thanks, Matt.
Thanks, Ian and Matt. Any questions to Matt and Ian this morning on the presentation? No. I think your comments are well placed, Ian. I think we will have to keep this under review and see, that investment that was made has proved right and is helping us. But I'm sure that we will have continued challenges. So being able to escalate capacity issues and to be really clear about them is really important. So, please do continue to do that. And thanks. I think your comments are well placed. So I know the board would want to put on record the thanks to staff. If you could feed that back, that'd be very helpful. I know we took it slightly out of order, so we could move back to you, Rebecca, for the update on the progress on the looked after children theme.
Yeah, that's fine. Can I just confirm that people can hear me? Lovely. Apologies, on my phone, so I'll try not to wobble too much this morning. So thank you for inviting me to come and give this update today. Obviously, it's an area of work that I work really closely with in relation to Helen Sweeton as our Joint CCG Commissioner. And I think the overview gives a good indication of some of the key successes that we've had over this period and the pieces of work that continue to be a key priority for us. So there has been quite a significant amount of work over the past 12 months in relation to health assessments and ensuring that they are timely, that they are focused. They play a really key role in a benchmark for where children are when they become looked after, often at their most vulnerable, and allow us to track and boost their physical health, which is really important. And I have to say that that has worked really well. So really positive in relation to that, even through the pandemic. So that's been positive. And I think we have listened to young people, and I know that the doctors are willing to go back into communities rather than have health assessments in hospital, which has been a direct request of young people. And I know that we are looking to put that back in place in September, obviously always under review. But I do think that shows that really sophisticated system to be in the place of listening to our young people and making sure the arrangements work for them. So I'm really pleased with that. In terms of through the pandemic as well, what I think we've done is come together well. We always do this, but I think what the pandemic has shown us is how conversations face to face are key, and it supports vulnerable young people. And we developed the multi-agency vulnerable children's group through the pandemic, which initially met 3 times a week as key partners to look at what the gaps and challenges may be for our young people and families. And that's now meeting once a week, and we've kept that in, and I think we will keep that in because it's a real point of contact for us to make sure that we've all got the same narrative, that we're checking out that narrative with people. We are triangulating what our young people and families may be struggling with, and we're sharing good practice. So actually operationally, but also strategically, that's been really, really positive. That's developed things like our baby clinic, where midwives and social workers work really closely around referrals. So a really positive piece of work that was certainly picked up in the ICP annual report as well as a strength. Very mindful I've only got a few minutes, but if we move on to what we are worried about, I think one of the key pieces of work that Helen and I have really picked up and tried to explore and build on from the report that I think was presented back in April 2021, which looked at trying to support some of our really complex young people who have significant trauma experiences, sometimes presentation that may be linked to trauma or may be linked to a diagnosis, and how we can best meet that need without them getting stuck in pathways, so that we can really determine the best level of support. Because if we can determine the support, that sometimes means that we've got a much clearer either diagnosis or a support package around that child. So we've done quite a bit of work trying to understand those needs, trying to work closely with adults and adult mental health about the children that we work with that then move on to their services as well, and trying to do some learning jointly. So in terms of what needs to happen next, we do have a good collaboration with CAMHS for children in acute within looked after services. And what Helen and I think the service want to do is look at whether we can create some greater prioritisation for looked after children within those pathways, acknowledging some of those waiting lists, but thinking about those being our most vulnerable young people. And as I said, sometimes the support and the intervention may be able to, that triage, which I know CAMHS have really moved forward with over the pandemic as well, may be able to help us get the best support to have the greatest impact for those young people. And that then impacts on their family home stability as well. We've looked at how we can work really closely with the Rotherham therapeutic team and CAMHS to make sure that we have a collaborative way of working and that it's complementary. One is not doing what the other is doing, so that work continues. Other key areas are around trying to make sure that we've got good joint commissioning arrangements in place to make sure that for those young people that are in the SENH category, we know from the outset we're commissioning together and reviewing the package together rather than social care reviewing and then CCG Health reviewing their input as well. We've talked a lot about providing a mental health transition pathway. Again, lots of work I think is really picked up as Helen's joined us, and I think the knowledge within the system is much clearer, good links with adults. And then I've jumped slightly, but just because it was slightly different, one of the key areas that we need and continue to need to work on in the South Yorkshire area, but particularly Rotherham, is dental care for our looked after children. We know South Yorkshire has a poor legacy in terms of dental, so it's a really key priority for us, and we need to move past its recording. We need to really get underneath, and I know particularly the lack safeguarding nurse has worked really closely, and a designated nurse, to try and get good relationships with local dentists, for example, and have that priority. So pieces of work to continue to move forward on, but I just feel really positive about the collaboration and the work that we're able to do together, trying to make sure pathways come together so that children and people aren't going through multiple pathways, I think is key, and that seems to be having some success.
Thank you, Rebecca. That was really helpful. Questions and colleagues to Rebecca and team? Shafiq?
Thank you, Sharon. Thank you, Rebecca. That was really comprehensive. I wonder, to what extent are we cited on some of the voluntary sector provision around support to looked after children, and especially those with SEMH needs? Because I'm conscious that we've got, for example, the Smiles for Miles programme, which is a range and a basket of services, particularly for SEMH needs young people.
Yes, I think the teams and the team around the child often are very skilled in relation to knowing and how we can support and signpost. I think it's always an area we need to refresh because criteria changes and staff change. So I think making sure that we've got access to that information, not necessarily in a directory, but that we've got key points within organisations is always really helpful. So I think that might be something that we could work to look at to refresh and to make sure it's almost annual. Because I think, as I say, sometimes personnel change and that can impact. But I know we work very closely on that team around the child model to try and make sure that we utilise the skill set. But yeah, I would be happy to look at that and further review.
Can I just add to that as well, Rebecca? Shafiq, Ashley Leggett sits on our SEMH strategy group, and at the next one, which is next week, he's doing us a presentation and providing us with information to review the impact of the Smiles for Miles activity. We do try very much, it's not specifically for looked after children, obviously, that it's available for a number of children across the borough, but we do try very much to include it, and we're looking at what's available within the local offer to make sure that the work that the voluntary sector are doing is available there, so people can see it. I'll make sure that your views are recorded when we have that meeting next week in the SEMH strategy group.
Thank you.
There's lots more that Rebecca could have told you about. We were just trying to keep the presentation quite specific because of the time.
Thank you, Helen. And any other questions from colleagues? I suppose the only question I had, Rebecca and Helen, and I think we can take it out of the meeting, but it'd be really helpful, given that the recommendations were from April 2021 and can see that work has been ongoing, that actually we're really clear about the timeliness of the next steps that are outlined. And also, I'm always conscious of the timeliness of the health assessments for our looked after children, because I know that has potentially challenged us previously. So I think it'd be really helpful just to get some feedback on the timing of those next steps, and also ensuring that timeliness of the health assessments. But really glad to see that they will be back out in the community, because I know some of our young people have raised that issue previously, particularly when they've had to go out of school, and so I know that we've had quite a lot of feedback from our young people about what would make sense to them and what would help them in their journey, and really want to see that is writ large over the next steps that we're taking. Anything else that colleagues would want to feedback for future? No? Thank you, Rebecca, and thank you, Helen. Our next agenda item is an update on enhanced care in care homes, and we've got Michael and Ian.
Thank you, Sharon. I'd like to invite Steph to deliver the presentation, who's pulled it together for us. Thank you.
Thanks, Michael. Thank you, Chair. Just waiting for the slides to come up. Thank you, Gordon. So just a refresher about what the Enhanced Health and Care Homes is for anyone who's new to the group. On the next slide, please, Gordon. It's a national framework which sets out a clear vision for care homes, and it's about integrated working across health, social care and with the care homes. And it's to ensure that all residents have the same access to care services as they would as if they were living in a private home. And it's to ensure people remain as independent as possible for as long as possible. So we carried out a benchmark exercise against the framework last year and identified 5 key priorities that we wanted to focus on. So these can be divided into the clinical areas. The first one was around hydration, which Stuart Lakin from the CCG led, and again it was an MDT group. And they looked at the evidence from care homes about the homes with the highest number of ambulance call-outs. And they targeted these 4 care homes for some really focused work around hydration. And this included identifying what the training needs were and developing virtual training packages, because of course all this was happening through COVID. And there's been some really successful outcomes, fewer hospital admissions, less use of antibiotics, less UTIs, so less confusion and a reduction in falls. And this has been shared with other care homes, and other care homes are coming on board. We've had some national funding to develop the training package, and this is going to be rolled out across the borough. And the group is also working with the ICS on that. The second clinical area was around MDT working. Dr. Kirsch has been doing some targeted work with Leyden Court and the ambulance service, looking at reducing conveyances to hospital. That's linking in with where there's been a fall, making sure if there wasn't a risk that the person was cared for and monitored in the home. And that was really successful and reduced conveyances by up to 80% over the last year. They're just picking up with what Matt was saying in the earlier presentation. There has been an uptick in January, which reflects some specific incidences at Leyden, but also the churn in the sector with the high number of COVID cases and the impact on staffing. But this is something again that's been shared across the borough and in the wider area, and it's attracted a lot of interest, so something we're looking to roll out. Dr. Kirsch has also been working with colleagues from the CCG and primary care to look at how care homes are supported through the weekly MDTs. There's no national model for that, so there is variation. So we're looking to develop a core standard that everybody works to. The third area is around digital support, and we've got three priorities within this. One's around remote monitoring. So there's a pilot going on at the moment for digital referrals, and one care home is piloting remote observations. We've just done a review of that, and the pilot's going to be extended for another year. And Rotherham's piloting this on behalf of the ICS. The second area under digital is around echo training. And this is peer support through online training. So the care homes identify the areas they want to work on, and they develop the training, with facilitated training, but the solutions are developed through peer support. We originally started developing this through with Sheffield, St Luke's, and now we're working with Doncaster, where we've pooled our resources and we've got a joint facilitator. and we're looking at the next set of areas that are going to be developed. And then the final digital area is around the shared care record. So last year we carried out a piece of work to extend the Rotherham Health Record to have a specific care home view, and that was made available to health and social care colleagues. We had planned to roll that out to care homes, but actually what we've started to develop working with our commissioned community bed base is looking at a shared care record, which actually gives you wider access to information, obviously in a controlled way with all the data protection in place, but it's all of the information is real time. So that's really important for helping with support for the individual and for system flow. So we're looking at developing that for the community bed base and then rolling that out if it's successful across the borough. So that's the work that's been going on and it's been progressing well. Obviously it's been impacted by COVID, but we've managed to keep it going through the pandemic. So the areas we're worried about, again, similar to other work streams, system pressures impacting on turnover of staff, ongoing difficulties around recruitment and retaining staff. This is particularly impacted on the care home sector. So there's been an increased uptake of using agency staff. And of course, that means people we've trained up have left the sector. So we're having to do a lot of repeat training and managing care quality. COVID outbreaks have impacted on service delivery, both with staff going off sick, but also closures of care homes. And we're finding with the ageing population, we're getting increased complexity of residents with long-term conditions that need supporting in care homes. And that includes end-of-life patients and palliative pathways, people with complex needs. Underpinning all of this are the inflationary costs that are impacting on everybody, but it's creating financial pressure on the care market, which is already fragile because of the impact of the pandemic. And one of the big issues around our digital activity is that there is varied digital capability and access within care homes. A lot of work has been done during the pandemic to raise digital quality and accessibility. All care homes in Rotherham now have access to Wi-Fi. And you probably remember from earlier reports around this work stream is a lot of work was done in partnership with Barclays to improve the digital capability and access to Wi-Fi. So we're reaping the benefits of that now. So moving on and looking at next steps. In terms of the clinical work, we're benchmarking again against the national pilot and identifying new priorities for this coming year. The hydration project has received this additional funding, so they're recruiting a project manager to roll out the work across all care homes and completing the care package training. And in terms of MDT working, we'll be re-engaging with the GPs if and when things quieten down a bit and people have some headspace. And we'll be rolling out the Leyden Court pilot to other care homes. For the digital activity, as I mentioned earlier, we've carried out the independent review of the pilot. We'll be extending remote monitoring, and we will be using the learning from the remote monitoring in care homes to inform our procurement of remote monitoring solution for the virtual ward, which we mentioned at the last meeting. The ECHO online training, there's discussions going on with Sheffield and Barnsley because there's potential to roll it out with them. And with the shared care record, we've got a cross-system group that are progressing this work, working with Aythorpe Lodge and Davis Court Intermediate Care Beds. And we'll be developing an option paper around what the shared care solution will be. So thank you.
Thanks, and thanks, Steph, and good to see the pilot continuing. Ian, did you want to add anything, Ian Spicer?
Not specifically, thanks, Sharon. I think that run through was really accurate in the position. I just really want to reflect that, you know, it's a really positive piece of work with a lot of progress in supporting the care homes in managing, as Steph describes, a sort of a rising demand in terms of acuity and sort of level of need that we're experiencing. So it's really important we continue that support to the care homes. Thank you.
I think we got most of that, Ian. It went a bit funny at one point in terms of the sound.
Apologies.
That's all right. You're clear now, and I think we got the gist of it, that it's really important we continue it, particularly given the fragility of the care home market. And I know our next item is going to be on workforce, so making sure that we think about our workforce in the widest sense as a system becomes really important. Any other comments and feedback for Steph and Ian this morning? No. And again, thanks. This is really, really important piece of work that we'll need to take the learning from and see what from the pilot becomes part of our mainstream working. But it's probably a nice segue, Leanne, into your item on the enabling group around workforce, particularly picking up on the challenges that Steph has identified.
Yeah, thank you. Morning, colleagues. I'm just going to share my screen. Just bear with me 1 second. Colleagues can just confirm if they can see that.
Yeah, we've got that.
Great, thank you, thanks. Okay, so just in terms of an update on the workforce and organisational development enabling group. So in terms of what's working well, I think the last 2 years has definitely been challenging and capacity has been limited due to ongoing workforce pressures within the system. But towards the end of last year and in the beginning of 2022, we've started to move forward, and the group's taken the opportunity to refresh and refocus. So this has resulted in increased communications between partners, and also as identifying some new key stakeholders that are operating at a local and regional level, and developing some really positive relationships based around the ambitions of Rotherham as a place. So I think in particular around the RNN group, Rotherham United Community Sports Trust, RIDO, and colleagues that are developing the QDOS Careers Hub, as well as colleagues within the ICS. To help us move forward and think about actually what we're doing and make sure, you know, we've done some benchmarking with other places under integrated care partnerships, and that's both region, neighbouring and regional, to look at identifying areas of good practice and share lessons learned in relation to workforce activities and initiatives. And this is support the development of the refreshed priorities, which you can see on the screen. And these have been aligned to the Rotherham Place Plan, the NHS People Plan, and also plans that we have as an integrated care system. So think about what we're doing from a development perspective. And so this has ensured that as an enabling group, we've agreed actions that will help us to deliver some tangible outcomes, because that's really key for us. One of which is around a place health and social care recruitment event, and I'll give some further details on that in a second. A particular highlight of more recently in terms of what's working well has been the strong links that we've made with the ICS Future Workforce Group and also school and education engagement officers. These relationships are essential, and they're really going to help us provide the foundation for success, especially in relation to priority 2 and encouraging young people across the borough to consider a career in health and social care. So in terms of what we are worried about, I think thinking about what's coming down the line in terms of changes at an ICS level, I think it's about the scope of the ICS ambition and how, as an enabling group, we'll be able to support this and translate this into place level activities, because it's going to be absolutely key that we ensure the workforce across the place are able to connect with the purpose alongside their existing organisational priorities and goals. And so we know there's going to be a little bit of a balance there. And that then links into the issues around consideration around capacity. You know, partners need to have the ability to be able to resource the activities so that they can progress these on behalf of the place. And, you know, we need to be considerate of existing operational and BAU, business as usual priorities. And so the balance has got to be found there in that area to ensure that we don't lose traction and that we're able to all commit and be equal in terms of taking some of these forward. And then the final point about what we're worried about, and Steph has just mentioned this a little bit, is around the ongoing resourcing challenges within adult social care. Attracting and retaining staff in this area is proving to be a challenge. We have had feedback to suggest that many who may be seeking employment and who might consider a career in social care can be potentially more attracted to roles within the NHS base, and that's based on pay and benefits. And so as a result, this results in staff using adult social care as a bit of a stepping stone or choosing to apply in different areas. So I think that's a real concern for us in terms of how we support colleagues and in terms of ensuring that they've got a talent pipeline and the correct flow of staff into that area. So then just moving on in terms of what needs to happen next. As an enabling group, we're going to continue to collaborate with the transformation groups and also the other enabling groups to move this agenda forward. A key focus is going to be around health and social care and connecting workforce to the place ambition. So we're going to develop a relationship mapping exercise that's already started, and we're going to be using this to support the group to maximise strengths and utilise existing knowledge across the borough to help us as a group deliver better together and also minimise duplication of effort, because we've got a lot of expertise working in different areas, and it's just about making sure we're joining those people up so they can come together. A number of milestones are going to be scoped out against the refreshed priorities that I showed on an earlier slide, and this will ensure that we've got realistic goals and recognise and celebrate the successes when they're achieved. And as mentioned earlier, we are planning for a health and social care recruitment event. We're planning to host this in June, and this will be linked to the ongoing resourcing challenges we've got, particularly around adult social care. We're going to base this very loosely on a recent event that the hospital ran, and we'll take the learning from that, and we're going to broaden that remit to health and social care roles. The plan is to host at either Riverside House or the Rotherham Hospital. We're looking for a location where we've got easy access and potential for high footfall. And we're going to bring on board wider partners. So thinking about Job Centre Plus, our Pathways colleagues in Rider. And we're going to look to run this event with the opportunity for individuals to attend, complete applications on the day, and if possible, undertake a short interview so that we can really maximise the time that we have with people when they actually come through the door. We're going to be looking at how we increase the interest in footfall, and to do that, we'll be working with the communications enabling group to develop that plan. And we plan to work with the RNN group, sixth form colleges and local businesses across the borough, especially in town centre and the markets, if possible, to try and encourage them to help us promote the event and signpost people on the day. The angle will be very much around working for Rotherham as a place and making a positive difference rather than focusing on choosing primarily between adult social care or NHS roles. And obviously, as staff come into us and talk to us, that there will be a choice being made, but the focus of the event is very much on how you can make a difference for Rotherham as a place. Happy to take any questions. Thank you.
Thanks, Leanne, and it's really good to see this start moving now. I know that we've been challenged because of capacity issues and people having to obviously focus on the immediacy, but really pleased to see this start coming through. I think it's going to be absolutely critical for us. Feedback, colleagues, any questions to Leanne this morning?
Hi, Sharon, I've got my hand up.
Sorry, Chris.
Sorry. I'm equally delighted, Sharon. This is fantastic, isn't it? We've been trying to do this for a couple of years, but we've never quite got the traction on it, have we? So this really feels like we're at a place to really kick this off. So I'd strongly encourage all partners to engage in this, as I'm sure you will anyway. But we need to just get some energy behind this, don't we? And make sure we make it happen this time.
Absolutely, and I know that a Rotherham Together partnership has actually identified some supporting funding as well to help with some of the activities that need to be undertaken. But a bit of a plea to all partners. I think this, it's always hard, isn't it, to take resource to think about things that are upstream. But actually, this is fundamentally critical to the workforce challenges that we've experienced, and some massive opportunities to support our local residents into career pathways. So really support the career pathways planning, because there are some really good entry-level roles that people can then be supported in terms of their skills and qualifications. So really important that we do take that time now. I bring Ian in.
Yeah, thanks, Chair. Just thanks, Leanne. Really good stuff in this space. One of the we were about to talk about health inequalities as well, Sharon, in a second. I think one of the things we really need to do is just link in. I think just a heads up to Place Board, you'll be receiving papers and information around the role of anchor institutions in the next kind of couple of months, and actually as partners in the system and anchor institutions, and it all links, doesn't it? Is what I was just going to say. And there's a real key theme coming out of that around workforce. So yeah, it all links in nicely.
Leanne, huge thanks to you and the group. This is one that, you know, as Chris said, we've been wanting to get more traction on, and just given the circumstances haven't been able to. But if there are any challenges around capacity and delivering some of the activity that we've got planned over the summer, please can you escalate it to Chris and I as chairs of this group, because this is absolutely a critical priority now. So please, you know, don't wait for the next meeting, just get hold of Chris and I, because we need every partner to participate in this to make those events successful. And then we can take the learning from that to further develop you know, things that go in the plan. So it's really quite exciting, but equally aware of, you know, we've got to do it and then take the learning from it. So, you know, let's get out there, let's try it, and then, you know, we can always refine it as we move on.
Yeah, thank you, Sharon. Yeah, and that echoes really what the group have been saying. We've talked about, we just really need to just do this now and then take the lessons and keep learning and keep building, start small and keep growing. Yeah, thanks.
Brilliant. Thanks, Leanne. Really excited. And please get the dates in our diaries, because I know there's some of us would really like to come along and support it.
Absolutely.
So please do let us know, and we'll be there to support that. Okay, so moving swiftly on, we've got an update from the Prevention and Health Equalities Enabling Group. Becky, are you doing this for us this morning? Thanks.
Yes, that's okay. Yeah, I'm here on behalf of Ben Anderson. So if anyone doesn't know me, I'm Becky William, Public Health Specialist at the Council. So this item, it did actually come to confidential last month, and Ben presented it. So I'm going to try and be not go into too much detail around that. But I think the main item is the Prevention, Health and Equality Strategy and Action Plan for consideration. So this has been developed by the Prevention, Health and Equalities Enabler Group. And I'll just draw your attention to page 14, because this provides a bit of a summary and some of the key priorities and the content of the strategy. So the Enabler Group has identified 5 key priorities. The first one being strengthening our understanding of health inequalities, which picks up on some of the population health management analytics work and also some of the community engagement work. I think there's a big piece around how we bring those two strands of work closer together. The second one is around developing the healthy lifestyles prevention pathway, and that's really focused on picking up on the key risk factors associated with disability adjusted life years in Rotherham, so smoking, weight, alcohol, and healthy ageing. The next 2 are around supporting the prevention and early diagnosis of chronic conditions and tackling clinical variation and promoting equity of access and care. And those 2 are very, very linked with each other, and also pick up on some of the national policy drivers. So all +5 strategy are covered between those 2 priorities. And we also picked up on some of the key areas outlined within the NHS operational planning guidance. And then the final one is the one that Ian's picked up on, which is around harnessing partners' roles as anchor institutions. We held a workshop on that in March, and I think we're working through kind of the feedback from that workshop around what the role
losing you,
of the
Becky.
prevention. Oh, sorry, you're losing me. Can you hear me now? Is that?
I can hear you.
Me?
I can hear you. I can hear you.
Oh, sorry about that. So I was just saying around the anchor institutions agenda, I think there's a lot more for us to work through following that workshop, including what the role of the prevention and health inequalities enabler group will be and what the relationship will be with some of the other enabler groups and other partnership bodies that are kind of operating within that space, with it being such a huge agenda. So the recommendation is that the strategy will run till 2025, with the caveat that we may need to review that at an earlier stage, given the huge amount of change that's happening within the system over the next couple of years. But we'll review the action plan on an annual basis, and some of those milestones will feed into the place board. And the recommendation is that the place board agrees the strategy and action plan today and notes the terms of reference. So apologies, that was quite quick, quite a whistle-stop tour, but I'm conscious of time. And I'll pass back over to you, Chair, for any questions.
Thanks, Becky, and I'm aware it's been well socialised through various groups as it's been being developed, so thank you for that. Colleagues, any questions and comments? And I think the recommendation is that we agree this today, but let's take any comments first. Any comments? People happy with the recommendations and the plan? I think we've all seen it, which is a really good sign, Becky, that we've all seen it in its various iterations, and I think we're all really supportive of this work stream and, you know, the importance of it. So thanks to you and Ben for making sure that we've all seen it on numerous occasions, and it's been through various groups and changed and took on board recommendations, and we can formally agree it this morning. Thanks, Becky. Chris, on to you. CCG, transferring legacy into learning.
This is just a quick item, Chair. So this is really for information. So obviously the current plan subject to legislation is that Rotherham Clinical Commissioning Group will cease to exist at the end of June, and the new South Yorkshire Integrated Care Board will form. This document just talks about locking in the learning from CCGs, make sure we don't lose in our new structures the benefits we've gained. So I've just put it on the agenda. We can just make sure that as we go through our planning and designing our new place, just make sure we lock in the legacy from the CCGs to make sure we keep the good, and then also develop the best practice as we move to a South Yorkshire system as well. So just for information today, Chair, and just so people have got sight of it.
Thanks, Chris. Any comments, questions? Important that we do take the learning as we think about what our future arrangements will be. People happy with that? Yep. Okay, thanks, Chris. We'll keep that under review. And then colleagues, just going back to my original agenda, she says on the action log and draft minutes from March. Any comments and anything to raise on the action log first? Lydia, is there anything you want to raise on that?
No, nothing at all, Chair. We've got the digital update, which is will either take place in May or June. That's the only outstanding item.
Thank you. Sorry, Richard.
It's ready, so everyone's prepped to come. So whenever you want to diarise it, we can come in.
That's great, Richard, and maybe we can take that on board and probably do it at the next one, if that's okay. Okay, yeah. So happy to accept those. Any communications to partners? Gordon, is there anything this morning we need to be cognizant of?
Just I think the workforce things Leanne went through, sorry. I think just around the dates and the events and getting people that in people's diaries and making sure we get that wider buy-in that you talked about, Chair. I think I'll work with Leanne if that's all right, and just how we get that out to the wider partnership and ensure we get partners on board with that.
Yeah. And the biggest issue, Gordon, will be making sure that our communities are aware so that people can come along and see what's open and the roles that are available to people. So really happy that we do some work on that to make sure that they're as positive as they can be.
Yeah, we'll work with the two groups to ensure that happens. Sure.
Brilliant, thank you. Any risks or items for escalation this morning, colleagues? Nope. Okay. And then we've got for our future agenda items, we've got our formal update on the development plans, which I always look forward to, as Lydia knows. What did we say we'll do, and have we done it, and what's the impact? And then we've got the review of the place-wide IT services report. I think if that's ready, we could take it for June, and then our rolling programme of updates. Anything that we've missed, colleagues, that might need to go on our next agenda? Anybody think of anything, then obviously contact Wendy or Lydia and we'll get that programmed in. And our next meeting is on the 4th of May. So I look forward to seeing everybody then. Thank you for this morning.